Okay, cool. I've got Mirian with me today.
Hello, Jenna.
Hello, darling. I'm so happy to have you for the next couple minutes where we sort out some of your problems. You want to maybe tell me?
Yo, I'm looking forward to this. So I have this knee issue here that comes and goes, but it's very painful sometimes, but sometimes it's just uncomfortable.
Okay.
So when I move, I feel like my knee's gonna give up at any minute. Like
Yes.
depending on how I stand or how I move. Some classes I cope with the pain, and some classes just the pain is there. So I just go through it. So I just want to see if I can improve it or get rid of it.
Yeah, let's have a look. I'm going to ask you to stand up for me.
Okay.
And then just face me.
Okay.
And march on the spot. I want you just to walk. Okay, and then stop. All right. I want you to stand on your right leg only. So just a little balance on one leg. Yep, and then let's do the other leg. It's shaking.
Yeah. This one is less stable, I guess, no?
Yes. And it's probably a bit weaker. Like the whole leg is looking like it's struggling. Can you feel that? And then relax. When you're standing normally, you tend to straighten your legs straighter than straight.
Oh, is it?
Yeah, they're bowing a little bit. Yeah, okay. They're like little bananas.
So I must make it like more relaxed.
So I would say if you can try and remember, because it's not going to happen naturally.
Okay.
But if you can try, every time you're standing for long periods of time, things like brushing your teeth or waiting for the kettle to boil or in a queue at the shops, you need a softness in your knees.
Okay.
So it's a micro bend, which means it's not visible to anyone else, but you feel it. You just bend your knees a little.
Okay.
Now you're standing with the muscles of your legs. You're not hanging on and hoping that the end of the joint is your stability. You're going to rope in the muscles on the front, sides, and back.
Okay. So I mustn't do these. I must go like this.
Yes, exactly. And that'll actually work your lower abdominals.
Oh, is it?
Yes.
Oh, that's
when
cool.
you slam your knees, feel when you straighten your legs, your hips move forward. We like
yes,
kind of
I can feel it there. Yes.
Yeah. So when you bend your knees a little bit, and then I push your hips back, maybe also a centimeter. So I just say I can make them live there. That'll make you bend. Can you feel now across? You're actually just engaging. It's like turning on.
Okay.
Let's take a seat now. I want you to put your leg up on here, and I'm going to fiddle with your kneecap. Okay. Tell me about this knee. Where's the pain?
Sometimes it's on this side.
On that
Sometimes
side.
It's here.
All right. So we got the joint line, and then also where your kneecap kind of runs over.
Yes. Yeah.
Okay, so you've got a nice knobbly knee.
Yeah.
It's quite a small little cap, and then there's a fat pad here. The knee likes to take a corner. There's the knee cap, it's over here. And then there's a normal fat pad, which is perfect, like everyone's got one. Fat pad there, and then there's a little tuberosity that the tendon moves and attaches to. So it goes over the fat pad from the bottom of the kneecap. And that's taking a little bit of an angle. So I don't know if you see, if I were to draw a line from this little tuberosity to the inferior pole of the kneecap, then from the inferior to the superior pole, and then it would hook another right angle towards the hip. So we're asking it to snake.
Okay.
Whenever we contract your quads, we're asking the cap to like move over, and that can be irritating. Okay, so what we need to work on is making sure that these muscles are in control of how this cap tracks. We've got strength there, and that your glutes do what they need to do, because when you're standing, you are falling into the foot a little bit, and that's going to just make more play at the joint. So no wonder it's irritable. So we figured out that we've got a shaking leg that likes to roll in and out, and a knee arrangement where the attachment of the cap onto your shin makes the knee cap have to take a bumpy road over the knee when we use the leg.
So it's twisting.
So it's got torsion, it's got friction, it's taking a route that's causing irritation. And what we can do about that is we can make sure that the inner thigh here is nice and strong so that it tracks better.
Okay.
And that you position your leg and hip with your hip above your foot so that you don't have such a big angle. So that when you are standing, let's jump up here. Stand on your left leg only. When you're standing, this bum does its job of keeping you living above the foot as opposed to sticking out to the side. Turn around and have a look in the mirror for me. So stand on one leg. You want that angle to be as little as possible. So you almost need to push over, and then stand like that. Feel how hard it is to do that?
Yeah, so I noticed the teacher always fix my hip, like if I don't sometimes put it in the right position, but I can't feel it. Like,
yes.
I don't know, I'm actually skewed.
So awareness is the first step. Realizing that your bottom on the side here could be a little stronger, and that your arch could be a little stronger, because that's going to reduce the friction at your knee. Okay. Right. Let's do some assessments to actually test this hypothesis.
Okay.
You're going to lie down on your mat and bend your knees, and then we'll do a pelvic curl. So you're going to lift your bottom up off the floor and lift your hips. Good. Now stay there. We want to keep the hips nice and level. So you imagine you've got a spirit leveler on your pelvis. You're going to straighten one leg for me. Did you feel how the right hip dipped?
Oh, dipped.
Yes. And then come back with your right foot and extend your left leg. And then when you dip, I dip, we dip. Can you feel?
Yeah.
All right. So fight the dipping and change your leg. So you're going to keep alternating and try and keep still. It's not easy, but just by trying to keep still, carry on. You're training the hips to be aware of the
where
strength needed on the side. Yes, and one more. Good, and then come down slowly. So that's a good exercise for you to actually do for homework.
Okay.
But it doesn't count if you're not concentrating. So if you're just letting the hips do what
So I just need to make sure that every time I lift my leg, I must make sure that the hip is straight at all times.
Step one, awareness.
Okay.
Your hip wants to dip, fight the good fight, don't let it dip. Right, so now we know that there's weakness there. We'll confirm it by lying on your side and face that way for me. Bend the knee up towards your chest. Yes, and put your right hand underneath your head so that you are supported. This left hip we're going to take forward, and then I'll take the left leg back. You've got a nice long leg here. You're going to try and engage this bum muscle at the back here.
Okay.
One is going to want to use the front leg, the front of the leg.
Okay.
Do not let these muscles do the job of this muscle. That's what I'm testing.
Okay.
So you're going to push your foot back to me like this and then down. Okay, go. Good. And again. Okay, and last one. Yes, excellent. Definitely you want to use the quad, but you're managing to get into that. Let's check the other side. It was quite weak though.
Yes.
Feel?
Ooh.
Yeah. Take the leg back. Okay. And then you're going to push into my hand backwards. No, that's very quaddy. Can you feel? Push backwards. Yes. Now lift. Yep. And down. And again. And last one. I have to ask you, what does this side feel like compared to the other side?
I think it was easier than the other side.
Yeah.
It was.
Yeah. And it was easier for you to recruit the right muscle. So the other side, the whole leg went hard and the whole leg tried to do the work.
Oh.
But on this side, you isolated and you didn't use as much of the accessory muscles, the helpers. So definitely think that we need to work your left bum.
Okay.
So you're gonna go onto your left shoulder on this side. So spin around, put your legs that side. Oh. Yes, and then put your shoulder down on your side. You're gonna lie on your side.
On my side.
Left side. So this one. Yeah. You're gonna go onto your shoulder like this, on your elbow. In the knees. I'm just gonna boss your body.
Okay.
Right hand behind your head. Great. So in this position, you can feel the body wants to collapse down towards the ground. You're going to try and make space and just get your iron yourself out. You're fine with your hand behind your head. Your head can come back. And you're going to lift your hips up off the floor. Great. Shove your pelvis forward for me. So lift your bum. Yes, there. Head back for me as well. So head back. Yeah. Okay, so we start with the basics. Get your spine in a straight line. Do you feel how much work is happening on the bottom of your body? I like that. Straighten your right leg, please. And then lock out this whole length of your body so you're tight. Your right leg you're going to lift and lower. Good. And keep going. But we want to work this bum, remember? Oh. Yes. And we want to work this bum, remember? So shove it forward.
Forward.
Squeeze. Yes. Head back for me. Hand behind your head further so that the elbow can go slightly forward. And keep closing the ribs and lifting your leg. Work the dent. And 5, 4, 3, 2, and 1. Relax.
Yo, the stuff.
Good. What we do on one side, we've got to do on the other. Head this way so that you're able to face forward.
Okay. So
we start by bending the knees and having your elbow down. Bend, bend, bend. Then your hand is behind your head and you're going to lift your body up and your hips lift up. And you shove your pelvis forward for me. Head comes back and ribs are closed. Lift your left leg up and down. Good. Try get back into this. Yes. You see how hard it is actually to turn this off. Even now your knees bending instead of your leg remaining straight because this hip flex is actually struggling not to engage. Can you feel it's like bending and this is moving forward. So I need length here. If I put my leg there, you got to go behind me. Thank you. Yes. Abs, abs, abs. 5, 4, 3, 2, and last 1. Okay. So we've spotted a compensation.
Oh.
The hip flexor thinks it's a bum.
Yeah, that's tough.
I know. So we need to let this guy have a break.
Okay.
So we need to stretch it. You're going to lie on your right side and relax. You know, I often talk about the body as being like the kneecap's angry and your hip flexor thinks it's a bum, as if it's got personality. But it's just that that's the role this muscle thinks it needs to play in that moment. And we've got to give it another option.
Okay.
So it's just trying to be helpful. It's not intentionally doing the wrong thing. Bend the knee for me. And grab your foot. Now, is it sore in your knee when you do this?
Yes.
Okay, cool. So if I take your foot away and I put my arm there and now you grab your foot.
No.
Grab your foot.
It's not sore there.
Good. And then rest. And I'm going to just relax here. How's that stretch for you?
Yeah, it's good, but it's not sore.
Okay, it's not painful. Does it feel like it's stretching?
Yes.
Okay, cool. So I'm going to let go. I'm going to get you to let go. Let go for a second. And then I'm going to rather get something else for you because you don't have me at home. Okay, so we've got a whole bunch of clean cloths. So I'm going to turn it into like a rolled towel.
Okay.
And so I'm going to roll it
so
up.
I must put something behind it when I stretch.
Yeah, well. And so there you go. And that's going to look a lot less awkward than me.
Oh, yeah. And it doesn't pain.
There you go. So it's important that we cover what you should care about in this stretch. The knee must come forward so that your back is safe. Do you feel that? And if you engage your tummy, your stretch actually gets bigger and your back is safer.
Okay.
So you want to tighten up ribs to hips and pubic bone to sternum. And then you've got a roll towel behind your knee. And that just opens the joint space. It's really relieving. For anybody that suffers from knee pain, this is my go-to stretch.
Big difference.
Huge. So previously, if I made you do the quadricep stretch, every time you did it, even though it was stretching the muscle that needs to be stretched, it came at a price to the
pain,
kneecap and the knee. So we're getting away with murder and we're doing what needs to be done.
Yes.
And relax. So you could pretty much do the bum strengthening and the quad stretching and get quite a few positive results.
Oh, awesome. So how often, like twice a week or every day?
No, I would do this every day.
Every day, okay.
I would do this every day because your strength gains that you can get in the first 3 weeks are all neurological. So your bum is actually just going to get stronger because you using it.
Okay.
And then if we're wanting to really get those muscles to change the density and strength, it would need to take longer than just 3 weeks. But in 3 weeks, you're going to get activation and you're going to get release.
Okay.
And then
So every day, how many repetitions should I make?
I would do 2 to 3 sets of the glutes exercises. So you've got the leg just lifting. the one where you pelvic curl and straighten one leg and then the other.
Okay.
You've got the one where you're planking and lifting the leg as well.
Okay.
And then we've got the stretch. So that's already
Okay.
4 things you've got to
4
do every
things.
day.
Yeah.
I've already got like a whole lifetime of follow-up exercises in my brain
Okay.
for you. There's some harder things that you would need to do, but I think you run the risk of getting too big a list and it never getting executed upon.
Yeah.
So let's stick with these 4, and
yeah.
then when you're feeling better, you can do more.
Go more. Okay. Awesome.
Cool.
Oh, that's brilliant.
Yay, well done.
Oh, thank you so much.
Are you sore now?
No. Actually, it feels good.
Okay.
I'm impressed. Thank you so much.
Well done.
Okay, so when I came in, I had a sensitivity. At the moment, it's gone. Magical. I'm feeling amazing. When I did the stretch without the towel, it was painful. But after she put the towel, completely gone the pain. So I'm feeling like at the moment pain-free, which is quite cool. And I'm feeling very confident that it will improve a lot if I follow what Jenna just advised me to do. So I'm gonna do it like, I don't know, like
every day.
No, but I mean like a mission. You know what I mean?
Good. You're
like
on
a mission. Yeah, I'm on a mission to just get it well. Because I know if I don't do what you told me, that it's for nothing. You know what I mean? So I'm gonna like stick to it like a mission. You know what I mean?
The best program is the one that gets done.
Yes, exactly. And I thank you so much, guys. I really, this is like life-changing experience because I actually thought it was, okay, I'm getting old and this is part of aging kind of situation, you know? So to know that I can fix it, doing the right things, then thank you guys. Thank you so much.
Pleasure.